How to maintain a healthy systolic blood pressure level. The human heart is an amazing organ that works continuously to ensure that the body's organs and tissues receive the oxygen and nutrients they need to function correctly. It does this by contracting and relaxing rhythmically, pumping blood through the circulatory system. Systolic is a crucial part of this process, and understanding it is essential to maintaining good cardiovascular health. Definition and physiology of systole. Systole is the contraction phase of the cardiac cycle, during which the heart's chambers contract to eject blood into the circulatory system. It occurs after the heart's electrical system sends an impulse that triggers the muscle cells in the heart's upper chambers, atria, to contract, followed by the lower chambers, ventricles. This contraction increases the pressure in the chambers and forces blood out of the heart through the aorta and pulmonary artery, respectively. Types of systole. There are two types of systole, atrial systole and ventricular systole. Atrial systole is the contraction of the atria, which occurs just before ventricular systole. During atrial systole, the atria push blood into the ventricles, which are relaxed at this stage. Ventricular systole is the contraction of the ventricles, which occurs immediately after atrial systole. During ventricular systole, the ventricles eject blood into the pulmonary artery and aorta. Measuring systolic blood pressure. Systolic blood pressure is the pressure in the arteries during ventricular systole, and it is an essential measurement of cardiovascular health. The standard method of measuring systolic blood pressure is using a sphygmomanometer, which consists of an inflatable cuff, a pressure gauge, and a stethoscope. The cuff is placed around the upper arm, and the pressure is increased until it exceeds the systolic pressure, causing the artery to close temporarily. The pressure is then released gradually, and the systolic pressure is recorded when the first sound is heard through the stethoscope. Abnormal systolic function. An abnormal systolic function can lead to various cardiac disorders such as heart failure, cardiomyopathy, and hypertension. Heart failure is a condition in which the heart cannot pump enough blood to meet the body's needs. Cardiomyopathy is a disease that affects the heart muscle, leading to reduced pumping capacity. Hypertension, or high blood pressure, can result in damage to the heart, blood vessels, and other organs. Maintaining healthy systolic function. Maintaining healthy systolic function is crucial for overall cardiovascular health. Lifestyle modifications such as regular exercise, a healthy diet, and avoiding smoking can reduce the risk of cardiovascular disease. Treatment for abnormal systolic function may include medication, surgery, or other interventions. Monitoring blood pressure regularly and seeking medical attention for any abnormal readings is also important. Conclusion. Systole is a critical part of the cardiac cycle, and understanding it is essential to maintaining good cardiovascular health. It is the contraction phase of the heart's chambers, which eject blood into the circulatory system. There are two types of systole, atrial systole and ventricular systole, which occur in a coordinated sequence. Abnormal systolic function can lead to various cardiac disorders, including heart failure, cardiomyopathy, and hypertension. Maintaining healthy systolic function requires a combination of lifestyle modifications and medical intervention, depending on the individual's needs. Regular monitoring of blood pressure and seeking medical attention for any abnormal readings is crucial to overall cardiovascular health.